In today's video, we will touch on a very delicate topic, premature ejaculation. This video is extremely important to watch for those who suffer from premature ejaculation and have been trying to get rid of this condition for many years, and has already tried different methods but nothing helps him. At the end of this video, you will learn how to treat premature ejaculation, which methods are effective, how effective they are, and what you can expect from them. Application. Therefore, get comfortable, let's start. We need to understand what premature ejaculation is. Premature ejaculation is the inability to complete sexual intercourse. In very simple terms, I'm talking about when you or your partner are satisfied with it. Well, let's say your partner wants to have sex. 40 minutes. Would that be considered premature ejaculation? Of course not. It's the same as when patients sometimes come and say, I want to have sex for an hour. Would ejaculation at the 50th minute be considered premature ejaculation? Of course not. If we look at European statistics as well as the statistics of our own country, we consider premature ejaculation to be the inability to prolong sexual intercourse for more than 3 minutes. Therefore, if you finish sexual intercourse in less than 3 minutes, then in principle you can be classified as someone who has premature ejaculation. But let's say you're satisfied with your 2.5 minutes and your wife is also satisfied with 2.5 minutes. Do you need to do anything about it? No. That's why it's extremely important, not just whether you fall into the statistics or not, but whether your partner is satisfied with the quality of your sex life that you can have with this duration. And that's why today I'm going to talk about the most commonly used, the most effective methods that exist today. Because the internet is full of different methods, 85 to 90% of which don't work. They don't work. And the goal of all these so-called charlatans who sell you miracle pills is to profit from your condition. The first thing to understand is whether this is actually a disease. Because sometimes it's actually a sign of some pathological condition. Well, for example, prostatitis or, for instance, a decrease in sexual hormones. But in most cases, about 70% of those who seek help, it's not actually a disease. It's his peculiarity, it's a condition you were born with, it's a feature of your nervous system, it's a characteristic of the innervation of the penis, and it's not a disease. And as long as you consider it a disease and keep looking for the cause of this disease, you'll never be able to deal with it. The most important thing is to understand. To understand, this is actually very, very simple. Just one answer to a question will allow you to understand whether it's a disease or a condition. It's a question that, once answered, will help you figure out the situation. If you've always finished quickly, it may simply be your individual trait. Have you consistently experienced rapid ejaculation? But if, let's say, from the beginning of your sex life at 15 up to 25, everything was fine for you, and suddenly at 25, after some unsuccessful sexual experience or a breakup with your spouse or a long break or recovery, that is, you gained weight, maybe there are some hormonal problems, your sex life changed, then maybe this is really a manifestation of neuroendocrine disorders, and in that case it can be treated. But if this is just your individual trait, you can only try to improve it or come to terms with it. And regarding today's situation, which we will analyze using certain methods, we will talk about a situation when this is your trait. Because when it's an illness, well, if you get treatment, your hormones will get back to normal, the infection will leave your prostate, and most likely your problem will go away as well. But most people who are watching me right now, I'm sure, have been living with this problem since the very beginning of their sexual life. So, if you are one of those people who want to change your sex life by prolonging ejaculation, give a like, and I will definitely tell you everything in detail and honestly about how to do it. Let's start with the smaller things. In general, it is customary to start treating all diseases from the beginning, from where there is no invasion. That is, not to cut right away, not to sew something on, not to inject something. Start from the smaller things and move to the bigger ones. The simplest thing you can do is use barrier contraceptives. Using a condom can help you last longer during sex. The second option is to use special sprays or prolonging ointments, apply them to the penis, which dulls the nerve sensitivity, and then have sex. A downside is that if your partner contacts the gel and you don't remove it, which I recommend, she might also be affected. Or you can put a condom on top, but then the sensitivity of intercourse for her will also decrease. Sometimes, because of this, it's possible to increase the duration of intercourse 2 or even 3 times. If this helps you, keep practicing it. If you feel comfortable and your partner feels comfortable, stick with this method. You probably have a question in your mind. Is it possible to do this for years? Yes, you can. They are absolutely safe. All of these are anesthetics. There are even condoms that already have lubricant containing it. An anesthetic because most often they contain lidocaine. So go ahead and use them without worrying about any side effects. If you don't have an allergy, you can safely use it for a long time. The second thing I can recommend is using medications that belong to the group of serotonin reuptake inhibitors. The group, which I won't name to avoid advertising, provides genuine assistance. You can find them through their active presence. By the way, from my own observation, for those whose prolongation of sexual intercourse happens when they consume alcohol, these medications usually help such patients as well. Downsides include potential migraines, nausea, and weakness, as some people don't tolerate them well. The only way to know if you'll experience this is by trying. Another possible downside is that while you're taking it, it helps, but once you stop taking it, it stops helping. So, well, it's a bit costly, on the other hand. On the other hand, condoms aren't free either. If you use anesthetics, they aren't free either. So, if it's comfortable for you, then use it. If pills work for you and you tolerate them well, take the pills.
Alexander, what about folk remedies? I did my homework, I read about it. There's pomegranate juice, arugula, walnuts, and a lot of other things. They say that these substances, they change everything, prolong everything, make things last longer.
Unfortunately, all the folk remedies that exist, they don't show their effectiveness in any way. Sometimes this is used and it helps people who, it's temporary phenomenon. And maybe there are some health benefits. After getting prostatitis, it went away and my hormones got better. Rest and prioritize your health. Premature ejaculation is a condition some people are born with. That they don't. Pomegranate juice, birch juice, or any other juice won't help, even if you soak your underwear in it. Also, the simple thing that really works and helps is the start-stop technique. The start-stop technique. It's been around for decades, and its effectiveness has really been confirmed by scientific research. What is its essence? The point is to bring yourself to the brink of orgasm, and literally being just a step away from climax, stop any stimulation. Wait, maybe 20 seconds, maybe 30 seconds, maybe 50 seconds. As long as you need to push back the moment of orgasm and then resume stimulation until you approach climax again. Stop again and by delaying prevent the onset of orgasm. Over time, by practicing this technique, you can increase your duration. That is, you learn to control and dull your sensitivity, meaning you work on the problem at the mental level. This really doesn't work in just 1 or 2 tries, but you can practice this technique without a partner and also with a partner if she is your regular partner. She is understanding, she will be supportive and realize why all this is being practiced and done.
Somewhere I heard that such interruptions are very harmful for something. I don't know, it's very harsh, negative.
There are 2 consequences when the seminal vesicles become too full. It's not very good. It's bad if in the end it doesn't lead to anything. That's bad.
But yogis do this. They sometimes do it though if there is some kind of stimulation, but they don't finish for months.
Yogov's presence is felt here. Like any process, it has advantages and disadvantages. To overfill the seminal vesicles and not finish this ejaculation, yes, but usually people who have a short sexual act rarely suffer from their seminal vesicles getting so overfilled and with ejaculation. They hold it for an extended period, which ultimately makes it harmful when considering the total duration. If we're discussing someone who engages in sexual activity for 20 to 40 minutes, then prolongs it for another 30 to 40 minutes. These start-stop techniques actually turn a 2-minute task into an 8-minute one. And in the context of people with premature ejaculation, this is not harmful. So you can safely practice based on the duration you currently have. For you, it will be absolutely safe. If it helps you, just do it calmly and don't worry about anything. Maybe there are other methods, not medications, but specifically techniques that you have practiced that have helped you. Share them in the comments. Maybe someone will see it, try it, and it will help them too. I'm absolutely not against anything that really works. Let's probably start with what already relates to intervention, to implementation, to interference. The first thing is injections. Injections with fillers are what I've already talked about. The glans itself is injected in a circle, the glans is injected around the urethra, and the frenulum itself is injected. The fillers used for penis enlargement and lip augmentation are the same ones I mentioned earlier. It's completely safe, simple to repeat, and temporarily absorbed. With a quality product, you shouldn't worry about any health issues or consequences. If it helps you, use it. A good test is the lidocaine test. If the lidocaine test helps you, meaning any anesthetic works for you, then most likely filler injections will help you as well. The effect may last twice as long for you, a year or perhaps only a month. You need to try, you need to see if it suits you and how well it suits you. That is, there are different methods, and for each person, one method will be the best. If we talk about the basic principles of treatment, the simplest one is frenulotomy. This is the removal of the frenulum, that is, this is the plastic frenulum. It is cut, especially if you have a short frenulum, but in general, I recommend removing the entire frenulum. The whole frenulum is removed. This is such an erogenous zone, and accordingly, the area of partial stimulation is also removed. And perhaps in your case, frenulotomy will help you stay at the peak of sexual activity for a longer time.
What are the consequences? Does it not grow back?
The frenulum, no, it does not grow back, and there can't be any consequences after the procedure. Many people tear the frenulum, they tear it accidentally and then come in to get plastic surgery. It's absolutely safe, it's done under local anesthesia, so you don't even have to do it under general anesthesia. Maybe the next thing after the frenulum will really help you, so let's sit from the smallest to the largest. Circumcision involves removing the foreskin, but it should be done correctly. Often circumcision is performed leaving a turtleneck, a small portion of the foreskin or mucous membrane. Here's the principle. When people come to a urologist requesting circumcision, I ask them why. Sometimes it's for religious reasons, but when questioned further, the motivations become clearer. When discussing premature ejaculation with a doctor, it's crucial to be honest about your goals. Circumcision is not performed for hygienic reasons, but specifically to prolong intercourse, because in this case circumcision needs to be done a bit differently. The frenulum should be completely removed during circumcision. The mucous membrane that transitions from the skin to the glands should be completely removed, so that the skin goes directly to the glands. And this is extremely important. If the doctor performing your surgery doesn't know what you need, it might not be as effective and may not deliver the results you expect. How helpful is circumcision? Sometimes at first it can even get worse because the head is hypersensitive, but over time it gets better. Constant contact of the head with underwear. Rougher, simply rougher, and really the area of innervation decreases, and sometimes the effects turn out to be very good. The act? It can be prolonged from 2 or 3 minutes to 10 or 15. These are very good results. Unfortunately, until you have a circumcision or a frenulum removal, you won't be able to find out from us how many you will have. Does this help forever? The foreskin is skin and it doesn't grow back. The glands won't become as sensitive as it was before. But it can also happen that you had a circumcision, it was done properly and everything is fine, but it didn't help you.
Are you still here? Negative consequences of circumcision.
There are quite a few miracle workers in the world. I've seen cases where too much skin was removed and it turned into a real circus. Skin was stretched over the glands and it looked like our machine was being pulled tight. So here, if you leave too little, it's bad. If you take too much, it's also bad. It's not even like a cheek or an ear. The penis has something called an erection. Remember, you're not operating on a small child. There are many such patients who can bleed or start bleeding. The frenulum, for example, is a very tricky spot. It will keep bleeding until you seal the vessel. That's why professors don't like to perform such operations, because even though it's a very simple procedure, it can seriously damage a surgeon's reputation. There are studies about Botox. Botox actually isn't injected into the glands. It's injected into the bulbospongiosus muscles. These are the muscles at the base of the penis, running parallel to the urethra. And the studies that are currently being conducted show that for some patients this brings a temporary effect. Why is it temporary? Because Botox always works temporarily. But during the period when you can have sex for longer, you learn to control yourself and to control your sexual activity. And in general, many patients who suffer from premature ejaculation become more enduring over the years. That is, even if you don't do anything, you don't try to treat it or have surgery, it will get better over the years. Only time will tell how much. For some, everything improves considerably, and sexual intercourse that lasted only a minute or two in their teens can extend to 10 to 15 minutes. Why does the hormonal background change? We transform into experienced captains of lengthy journeys, no longer easily surprised or excited. There are actually many factors. Denervation is actually on the one hand a very effective, but on the other hand a rather tricky method of treatment. We expose the glands, remove the skin from the penis down to the base, and locate the nerves that run along the penis toward the glands. And those, well, there are different techniques. I'll tell you how I do it. We cut nerves larger than 2 millimeter and smaller than 1 millimeter nerves between 1-2 millimeter are left intact. And the main thing is to make sure that all these cuts are at an equal distance from each other. And so that there are no clusters of nerves. That is, so that a certain number of nerves remain at certain points. In other words, it's done like the hours on a clock face, so to speak. So that it doesn't happen that you removed everything here and there isn't a single nerve left, but over here there are still some. That is, the nerves should be preserved evenly and in certain sizes. It helps. What's the downside? You cut it, the nerve is already gone, and the downside is that you won't be able to restore it in 6 months. If a problem arises with the sensitivity of the glands, it can be seriously affected and disrupted, leading to issues of a completely different nature. I've rarely encountered this issue. Usually, even if there is a problem, recovery still occurs. This is a downside as the remaining nerve fibers take on the responsibility for conducting signals for the gland's sensitivity. It helps for half a year, it helps for 9 months, because most often those who come for this procedure think that it's once and for all. Unfortunately, it's not once and for all. There's some rollback after 6 to 9 months, and for some people even earlier. He can, unfortunately, happen. That is,
Everything restores itself there, yes.
yes, that's how it works by that principle. So you understand how cleverly nerves are arranged. Even if you take 2 wrong nerves, cut the nerves and sew together completely different ones, well, let's say the nerve that goes to your hand, sew it to the nerve that goes to your butt. And it's like a phone call, meaning the body senses that there's someone else on the other end, and over time the innervation changes. That's why nerves are sewn back together even when injured, one with another, and it's not always the original one that gets restored, or sometimes new pathways appear. Look, patients who've had strokes, they recover over time, or sometimes when a nerve is severed, skin sensitivity is lost, but then it gradually starts to come back even though that nerve is gone. Innovation is also important. In good hands, do it right, and be prepared that you might not get anything. Because unfortunately, it might turn out that in your case, the problem is actually here.
Exactly.
That's why you need to act from the smaller to the bigger. Start with anesthetics, start with fillers, and only as a last resort move on to surgical procedures. There are also other methods. They are not widespread, but today I will definitely tell you about them as well. We'll tell you about them. This RCHA radiofrequency ablation and cryoablation. This is with extremely low temperatures. What is their principle? They also destroy nerve fibers, but unlike cutting, we do not sever them, we disrupt their function. The advantage is that, unlike cutting, this method can be repeated. If you cut them, after 6 months everything regrows, leaving little left to cut. But cryodestruction can be repeated, and it is safe in the sense that if for some reason the consequences of cryodestruction are too negative, all of this is reversible. Unlike cutting, the chance for complete recovery with radiofrequency ablation, that's radiofrequency ablation, and cryodestruction is not higher, but these methods are extremely uncommon. The centers offering these procedures are researching them, and we only recently began studying this topic ourselves. Due to limited studies, these procedures are currently quite rare. Even if you take a city like Moscow, they are not included. The standard treatment offered to you... No, it's like a microwave, basically. We, as oncologists, use this in the treatment of kidney cancer. We perform radiofrequency ablation for kidney cancer. We puncture the kidney tumor through the skin. If it's small, not very big, up to 1 centimeter. For example, we can use the tip of the needle, apply high-frequency ultrasound, and burn it, basically roast it, turning it into a small piece of charcoal. The same principle, but with a more delicate selective needle and a more localized effect on the main trunk.
And on the nerve, for example, somewhere in America, in modern medicine, this method exists and is used.
Everything I listed, it's all the same, everything I said today. They will offer you this in the United States of America, they will offer you this in Canada, and they will offer you this in Switzerland. Unfortunately, you won't find anything truly new or some kind of major achievement that we don't have, but they do. These are the methods that exist today. They are widespread. Some places like them, some places don't, and in some places they don't consider them at all. Premature eyeglass prescription is a problem in many countries. If you are not satisfied with your sex life and your partner is not satisfied either, only then and only then should you do something about it. If you are satisfied, then everything is fine, even if it goes against your partner's wishes, to be honest. If everything is fine for you, you are satisfied and you don't want to change anything in your life. No, there's no need to get into this and listen to someone telling you what to do. Extending sexual intercourse by 3 to 5 minutes won't make you happy, and maybe all these risks just aren't worth it for you. If you've lived up to 40 or 45 years with sexual intercourse lasting 5 or 7 minutes, there's no need at 45 to try to turn those 5 to 7 minutes into 10, 12 or more. You lived calmly, were satisfied with your sex life, so think about why this satisfaction suddenly disappeared, where the problem really is, where the root of the issue lies. Because often what I mentioned happens. The psychological component also plays a role for spouses. After 35 years, I had a couple recently. When I got divorced, my wife cheated, all these new partners started to appear, and his sexual intercourse became insanely short. Before that, it used to be long, and sometimes it's the opposite. By the way, the duration of intercourse can be different with different partners. Sometimes premature ejaculation happens only with the wife, and with some new partner, it doesn't. As a supporter of marriage, I won't give advice on this matter.
Is there any difference in the safety of all these procedures? Like at 40 years old, at 20 years old, is there any difference?
It's equally safe whether you're 20 or 40. The question is just about whether it's appropriate. At 40, it's less questionable than at 60 or 70. Also, I had a patient once, 74 years old, who came in with premature ejaculation. I said, it's great that you have a sex life at all and you're satisfied and you're even trying to improve it. That's commendable, but you've made it to 73 years old and you'll live as long as God allows. Do you want to turn your 5 minutes into 78 minutes of play now? Calm down, there's no need really. Just sit and be glad that everything is working for you. About modern treatment methods, I share a lot of other interesting things on my channel, so make sure to subscribe. The link will be below. And soon I will post a very interesting presentation there about all the methods I talked about today and their effectiveness. And there, in a very clear and illustrative way, you will see the results before and after, and exactly what each method gives you. After, you can save this and use it as a guide if you decide to do something about your problem in the future. My friends, value your health and take care of it. If you have any problems, don't be shy to talk about them with your partners. Love them, appreciate them, and make sure to subscribe to my channel, hit the bell, and stay tuned for new episodes.